So how do we diagnose it? So when you go and see a doctor, if you're worried that you may have PSA, the doctor will take a very detailed history from you. Okay, so from all the symptoms that I've just listed, they will ask you lots of questions about yourself, but also about your family as well. And then after taking a history, we always do a thorough examination, and as well as looking at the joints and the tendons, we actually look very carefully at the scalp, the skin, the nails, and quite often we do pick up psoriasis. So we diagnose arthritis and psoriasis at the same time. So patients sometimes in the belly button or the back of the scalp, the hairline or behind the ear is not that obvious to see. So sometimes we do pick up psoriasis as well. So after examination, we tend to send patients off for blood tests. When you come and see a doctor, unfortunately, most of the time you do get a blood test. But for PSA, unfortunately, we don't have a diagnostic test to say, yes, you definitely have a PSA. It's all for clinical diagnosis. But the doctor will definitely carry out more blood tests, if anything, just to rule out other conditions. So for example, gout in patients with psoriasis, there's also increased risk of gout as well. So they would do blood tests for that, maybe do blood tests for rheumatoid arthritis as well. So after the blood test, we tend to do some imaging. X-ray is the most common thing we do. We do X-rays of the hands and feet, maybe, if you have those involvement, to look for any damage and to look for particular erosions that may be seen in PSA. And if you have back pain or bottom pain, we might send you for X-rays of your back and your pelvis, or SIJs, to look to see if there's any telltale signs there. If it's all clear, we may actually then move on to do more sophisticated and more detailed imaging. So at NUH, for example, we do ultrasound. Us as rheumatologists, actually, we carry out ultrasounds where we scan patients' joints. So sometimes it's not very obvious who's got inflammation and who doesn't, and the ultrasound is quite helpful in telling us more detail about how much inflammation there is in the joints. And sometimes ultrasound we use to look to see if there's any tendon problems or if Achilles is okay. And we also rely on MRI, particularly in the back, to look for any sort of inflammation of the spine or the pelvis. So after that, if you have a big hot swollen joint, we may actually then carry out a joint tap where we stick a little needle after some local anesthetic to take some fluid out, which will make you feel better in terms of symptom relief, but also to send it off to look to exclude other things like maybe infection or gout.